Hi, I'm Tom Burke, and welcome to Public Health on the Inside, your inside look into the world of public health. I'm the Associate Dean for Public Health Practice here at the Johns Hopkins Bloomberg School of Public Health, and through our series of podcasts, I want to take you to the front lines of public health and introduce you to the real world of public health practice. The world of public health practice is filled with opportunities, and that's what we'll explore on Public Health on the Inside. Now, we have talked a lot about dream jobs, and we've had a variety of guests in leadership positions, but today I have the honor and pleasure of talking with a true world leader in public health. He's also our newest doctoral degree holder. Today, it's with great pleasure that I introduce the former President of the Republic of Ecuador, Mr. President Dr. Alfredo Palacio. A cardiologist by training, Dr. Palacio served as the President of the Republic of Ecuador from April of 2005 until January 2007. Prior to assuming that role of President, he served as Vice President for over 2 years, and he was also the Minister of Health for the country. Since then, he has led a number of efforts working toward political and economic change and social development and healthcare reform. He's credited with the modernization of the healthcare system, helping to decentralize local health system, as well as promoting emergency medical service. And he's received numerous awards for his public health contributions. He's a teacher and an author of the book Health, Everyone's Right. President Palacio, welcome to Public Health on the Inside. Thank you so much for being here.
Well, thank you very much, Tom. It's actually my privilege to be with you this morning, as was a very high honor to be at Johns Hopkins, which I was talking to my friends here that since now I could call my alma mater too, because
Yes.
I received this high honor.
Well, we've had a wonderful connection to you, a family connection.
Right.
So your daughter is one of our degree holders as well.
That's right. My daughter comes from Hopkins. She's a master in public health, as my son-in-law too.
Oh, great.
Right.
Truly the
Both
Hopkins
of them.
family. Well,
That's
welcome,
right.
and thanks so much for being here. I want to start with, you've had an amazing journey from medical school to world leadership. Tell us a little bit about that.
Thank you very much, Tom. You know that sometimes for some people it's very difficult to understand that how could I have the two practicing function, the two practicing profession, be a practicing physician, practicing cardiologist, and also to be a practicing politician. And I never quit to be a physician to become a politician. I'm not trying to go back to politics because I always have been in politics. When I talk about my profession, when I talk about medical care, when I'm talking about public health, when I'm talking about the inequity and the lack of accessibility of the poor people to have a good, high standard medical care, I'm talking about politics. That's being a physician and also being a politician. And in the middle of that, being a university man, trying to form new generations without the social sensitivity, to practice a high excellence in medicine and also to trying to improve the standards for everyone.
That's great. Many of our colleagues are afraid of politics. They like to focus on their science or their medical practices, and they feel that politics is different and don't get involved. But you exemplify that continuum. If we're going to make change in public health, we have to be involved in the political process.
Yes, I think that the universal health insurance, public health, accessibility to a high standard medical care is very serious matter to be handled only by politicians. You need physicians get involved in that politics.
One part of your talk was actually a very interesting perspective that I hadn't heard before, but you talked about the loneliness of being president in contrast to the control that you had as a physician in the emergency room, where you could control the situation. That was a fascinating contrast for me.
Well, it is actually true, and I think that one of the privileges that I have received in my life is to have the taste of these two responsibilities. I think in the moment that you have to face that responsibility is exactly the same. The only difference is that when you're a physician, you really are in charge. You decide every little thing that you do. You just order and it's done. When you're in the presidency, you are not really in charge of everything. You give orders and have to give order for the next room, and your order may not be followed exactly. And that is a frustrating sensation.
Amazing perspective. Now, you were a tremendous advocate for science and evidence, and there is a place in political decision-making for science. And I'd love to hear your thoughts on building the science base for public health as you moved ahead with your successes.
Yes. I did my training in the States, my medical training. I was in a very wonderful university too. I was in Washington U and Barnes Hospital. And I finished my cardiology training after my internal medicine training there. So when I went back to my country, I tried to make change there. And initially I did, but in a very small area. I created an institute for young people, and we were doing a wonderful job until I realized that the scope that we had was very narrow. And I wanted to produce this change for a wider social spectrum, and that's to talk about at high level politics. And at that moment, when we did that, then we have to try that the people talk always based on evidence, as we do in medicine. And you have to try that your medical students, when they talk about medicine, always talk about evidence-based medicine. So these young doctors may become professors of new young doctors or professors of the society. So the society learn that when everybody talks, has to talk about evidence and not about illusional things. And we have to teach the politicians that the social problem is also a scientific problem, that you need evidence to produce a transformation.
You also had to take over a country that didn't have many resources, and you took on some big challenges, negotiating with the oil industry, trying to bring better resources to the country. Not your average doctor there. This is new ground, and so important to invest in the country and have the resources to build.
When I took over the country, my country was in crisis, in social, political crisis, and a few days later, I found that was also an economical crisis. But initially, the Supreme Court of Justice had disappeared. I had to create a new court, but without my influence. Had to be a very independent court, but I had to create it independent from me. That was a very difficult task. Obviously, I did exactly as a doctor. I call expertise from all over the world and international agencies to help me to create this court. And I took the power in April. In November, I had the court already. But the second problem that I had was the economic problem. I had no money at all. So people ask me where the money is. And I found a few things. For example, I was mentioning about this tremendous unfair agreement that we have with the oil companies, the foreign oil companies. And we have participation agreements with them that was 82% for them and 18% for the country. That was terrible. And the budget was handled with more external debts. So I had to make change, and I started with the oil and with the way that we pay in the external debts.
And so you changed the ratio of payment?
I couldn't change the agreements.
Right.
So I said, well, we're going to keep what you're saying because they didn't want to change the agreement, the companies. So I said, I'm going to keep 82.18, but with the price at the moment that we signed that.
I see.
You know,
Sure.
Every excedent from that price we will share it 50-50.
Fantastic.
50-50. And that gave us a tremendous amount of money for the health insurance, for education, and things like that. And I ask the people, I make a popular consult, ask 3 questions. Where do you want I put this money? Health insurance, some reforms in education, and all of this money should go to a place where it's not going into the general budget of the state, but only for health, for education, and for research.
Your perspective on investing in the people and investing in health. Some other leaders might think we have to invest in the economy. We have to become a wealthy country before we can invest in health. And yet your perspective is
It's health is the primary investment, and through a healthy country, you have a healthy economy.
That's right. I think that this is an ideological problem. And that's the kind of discussion that the world should have at that level. You may think that you need a flourishing economy to only then invest in health and education because you have the money. And many people think in that way. I think in the other way. I think that you need to invest in health and education to produce a citizen who is healthy, who is educated, who is protected, and then you are going to have a very flourishing economy.
Dr. Palacio, you're also a teacher, and I would love to take your class, but I would also like to ask you, based on your experience, your success, the challenges that you've seen, what kind of advice do you have for students, and what are the most important messages in your coursework and in your teachings?
I think the most important thing for a student is to be a student. You have to study reality. You have to follow the example of the ants. You know, that little insect works collectively, and they investigate the terrain, the temperature, the pH, that land is okay to live and to produce. But one thing I would like to mention, what kind of investigation I think we do in our universities. We need to open the spectrum of research about biology. That is the most important change that we have to do in general. And one important thing is about chronic diseases, because this is going to be a real problem in this century. Very real problem. You know, I was mentioning in one of my classes yesterday that the amount of deaths in the world is about 57 million, but 60% of those are chronic diseases, not acute diseases, not infectious diseases. It's myocardial infarction, cancer, diabetes, respiratory diseases. And amazing, 80% of those deaths are coming from the low-income, middle-income countries. 80%. So where we don't have resources. But the budget of the World Health Organization is 15 billion. Weapons, 1.5 trillion. This is a disproportionate war. Yeah. And this responsibility of the university to call the world to make those changes. Johns Hopkins is an example for the world. And thank you for the example that you are giving to the world, and I'll try to work together with you.
Mr. President, Dr. Palacio, thank you so much for being here today. You know, we have a slogan here at the Bloomberg School, and it's protecting health, saving lives, millions at a time. You truly have improved health millions at a time, and I thank you so much for your work. I would also like to thank the Latino Public Health Network for their assistance in arranging your visit and this interview. And thank you for being here today on Public Health on the Inside. See you next time.